Hello everyone, as we are dealing with the point Samanya Chikitsa Siddhanta, that is the general principles of treatment in children, right? So in part 1 of Samanya Chikitsa Siddhanta, what we saw, the types of diseases causing in a body, not only in children, in whole body, and what are the main causes to diagnose that, means what are the causes to get the diseases or discomforts in a body, and how we can treat the disease, especially in a children. What are the contraindications and indications in treating a children? These all points we saw in the first part of Samanya Chikitsa Siddhanta. So in this video we will move on to the next point, that is how we should treat the children and what are the main points to diagnose the correct way of disease, and how to examine a child to diagnose the correct disease and to treat the disease. These all points will be covered in part 2 and it will complete the Samanya Chikitsa Siddhanta. So we will move on for the topic. Okay, we are dealing with the treatment and how to diagnose and how to treat a child with the correct diagnosis is covered in this video. For the before topic, that is the types of diseases, the main causes for the diseases and way of treatment in a children. For these points you can refer my Samanya Chikitsa Siddhanta part 1 video, and here we will start with the Samanya Chikitsa Siddhanta part 2, that is the administration of drug in pediatric therapeutics. How you will administrate the drugs in a pediatric one by one according to the condition of a baby, because as in our pediatric Kaumarabhrutya age group is divided into 3 parts, that is Kshirapa, Kshiranada and Annada. The way of treatment is also according to the age of a child, that is for the disease of Kshirapa, the drug should be given to the mother only. As we all know, the Kshirapa child will be dependent for nutrition, for food, for everything fully on a mother, right? So if we give medicines for the mother, it will indirectly go to the baby from breast milk. So the medicine should be given for only mother here in condition of Kshirapa children. And for the disease of Kshira Annada, the drug should be given to both the mother as well as baby, because the mother, as the baby will be feeding the mother's milk, if the mother is vitiated through some diseases, then it will affect the baby also. So we should give treatment for both the mother and the baby in the condition of Kshira Annada. For the diseases in Annada, we can give drug should be given for only the baby, because the mother will not be related to the baby here for Annada condition. The baby will be having only outer food, not the mother's milk. So we can give medicine for only child here, not the mother. And Upvasa should not be performed. Upvasa means Langana. Langana is purely contraindicated in a children because they can't tolerate the Langana procedure. And drugs for Kshirapa should be Mrudu, as the Kshirapa children will be very sensitive in nature. So the administration of drugs should be Mrudu in nature. And Besaja Kala is Prabhakta. Prabhakta means, according to Harita Samhita, this Prabhakta is the main Besaja Kala for the children, because Prabhakta means nothing but before food. As after food, if you give medicine, usually the baby will vomit the medicine. So Acharya said that Prabhakta is the better time for the medicine for the children. So our next point is basics of pediatric therapeutics, means according to Indian Academic of Pediatrics, that is IAP, these steps to be kept in mind while practicing the applying the therapy on the diseased children, because if you keep all these 6 points in a mind, you can diagnose correctly and you can give the accurate treatment for a child. What are those? Reach a diagnosis, assess effectiveness of therapies, assess risk to be patient, inquire about the previous experience, drug dosage, drugs and breastfeeding. these 6 points if you keep accurately in your mind, then you can 100% cure the disease in a children. Not only in children, in elders also. Overall the treatment therapy should be kept in these 6 points. That is, reaching a diagnosis means if you reach a correct diagnosis, then only you can give the correct treatment, right? If the baby is having fever and if you are giving treatment for the cough and cold, how the fever will be cured, right? So like that, if you diagnose correctly what the baby is suffering from, then the treatment line of treatment will be correct and you will get the 100% result. And assess effectiveness of therapies. First of all, you should assess the bala of a children or a person, because how they will tolerate and how much the capacity of tolerating they have. According to that, if you give the therapies, then you will get the good results without any side effects. And assess risk to the patient. Nothing but same here, the before point, effectiveness of therapies, because if you know the bala of a patient, that is tolerating capacity of the baby or a patient, then you can go for the correct way of treatment without any risk or side effects, right? So you should know the risk to the patient, whether they are having any side effects for any diseases or for any medicines or anything. You should overview that and inquire about previous experiences. If they have any allergic medicines, you should ask for that, because if they have any allergic for any such one type of medicine, if you advise that, then they will be having side effects, right? So you should go for the previous experiences of their treatment. According to that, you can go for the further treatment of the disease. The next point is drug dosage. This is the main special point in every treatment. You should give the dosage of a drug in correct way, then only the disease will be cured. If you give low dose, then there will be no cure for the disease, and if you give high dose, then it will take the side effects for the person, right? So the drug dosage is main point to cure the disease. First you should keep in mind, especially in children, according to weight of the baby and according to age of the baby, you should divide the dosage of the drugs. And last point is drugs and breastfeeding. If you are giving treatment for the Kshirapa and Kshira Annada, they will be having breastfeeding, right? So according to that, you should advise the medicines or drugs. Those are those which cannot have any harm for the breastfeeding, you should see, and which are not harmful for the milk and which can combine with the breastfeeding, you should go for the treatment. If you keep these 6 points in elderly Annada, that breastfeeding is correlated with Annada, the diet. You should advise the diet according to the medicine, so that you can cure the disease perfectly 100%. So if you keep these 6 points in mind and if you treat the disease, you will get the 100% result accurately. But first of all, you should diagnose the disease correctly. Okay. Our next point is Bala Roga Pariksha Vidhi, that is pediatric case taking. This we can compare with the first point we saw in the last slide, right? Correct way of diagnosis. To diagnose a correct way, first of all we should examine in a correct way, right? So how we should examine? These 7 points you should keep in mind, that is observe, listen, play, palpate, conduct specific clinical examinations, conduct other tests specific of physical examination of a child. These all 7 points you should keep in mind for the correct way of diagnosis. Because as we know, the children will be vak asamarthya, vak cheshta asamarthya, that is they can't speak out what they are feeling, they can't say directly what the complaints are, right? You should examine the response of a baby and you should get the diagnosis of a correct way. that is as our Acharya Kashyapa explained Vedana Adhyaya in Kashyapa Samhita, he explained particular response of a child for particular pain. Like that, by giving the response by response to the stimulate, you can guess what the baby is feeling. According to that, we should follow these points, that is observe how you should observe the response of a baby. That is, if he is having headache, he will bang the head. If he is having abdomen pain, repeatedly he will touch the abdomen. If he is having any part pain, repeatedly he will touch the part of a body which he is having pain. Like that, you should observe the response or activities of a baby. Listen what the baby is saying. You should listen patiently. Patience is main thing in treating children, right? Play because usually babies will fear by seeing our apron, stethoscope, injections, everything, right? So you should play with baby so that the baby will mingle with you freely. Palpate because if you palpate the body of a baby, if there is any swelling like or any erosion scars, you can find out. And conduct specific clinical examinations. If you find any complaints or if you find any discomforts in some part, then you should go for the clinical examinations of specific part. Conduct other tests. If you feel any you want the reports of blood test or scans or something, because if he is having abdomen pain, internal organs we can't see from our eyes, right? We want the scans of abdomen. If he is having any cough problem, we need the x-ray reports. Like that, conduct other tests and specific of physical examination of a child. Particular, if you find any discomfort or complaints in particular part, you should go for the specific physical examination of a child. If he is having cough, you should examine the chest region, like lungs examination you should go for. Like that, particular part examination, physical part, you should go for the child. Then next point is examination of a diseased child. In last point, overall examination of a child you saw. When the patient or a child comes to your OPD, overall examination, what all you have to do, in last slide we saw. This part is according to the particular diseased child. After diagnosis, you will get some diagnosis of a child, right? After getting the diagnosis, how you should examine a child. General physical examination in 4 steps. That is, step 1, general appearance. That is, overall general appearance from head to toe you should see whether baby is having any hemiplegia or any cleft lip, cleft palate, or the drooling maybe, or all extremities. You have to see general appearance. Step 2 is head to foot examination. Head to foot examination, what all you will do? First of all, head circumference from coming to head, microcephaly or macrocephaly, or ear examination, and eyes examination, whether the squint eyes or anything, and then nose, passage of air, everything you have to see. Then mouth examination, the cleft palate or any difficulty in swallowing, mouth examination, or tongue examination you should do. Then coming to next, chest, the shape of the chest and the auscultation in the chest part you have to do. Then abdomen palpitation, if any megaly of organs you have to see, and especially in newborns, the umbilical hernia or any infections for the hernia you should see. Then genital parts in male genital parts and female genital parts you should see, examine clearly. Then extremities, if they are having any extra fingers or if there is any missing fingers, you have to see. For this head to toe whole examination, you can refer my Navajata Sishu Parikshana video. You will get it clearly. I explained very clearly in that video. So from head to toe examination you have to do. Step 3, vital signs. Vital signs nothing but blood pressure, heart rate, respiration rate. You have to examine what is the blood pressure off of the adult level, that is 60/40. 40 mmHg, that is blood pressure, heart rate 120 plus or minus 20 in newborns, and respiration rate 40 to 60 in newborns. It will gradually increase and comes to the normal range of adult after 6 months to 1 year. Then step 4 is anthropometry. Anthropometry is nothing but the head circumference, chest circumference, length of a baby, and BMI, total body mass index of a baby, will be covered in anthropometry. So these 4 steps you have to cover in examination of a diseased child, that is general physical examination in 4 steps. So you have to so that you can diagnose correct. Okay, our next point of examination is systemic examination. Those 4 steps of examination was about general physical examination, right? Our next point is systemic examination. Especially what all systems you will examine in a child, that is gastrointestinal tract and abdomen, respiratory system, cardiovascular system, and CNS, that is central nervous system, right? So how you will examine these systemic examinations, that is general physical examination, that is about the last 4 steps. Then inspection. Inspection means just you have to observe how the baby is feeling, whether the baby is having running nose, whether the baby is having cough, whether the baby is having breathlessness, or whether the baby is having discomfort in body. We have to inspect about the overall body. Next is palpation. Palpation means nothing but touch. By touching the body of the baby, you have to examine, especially abdomen, because if the baby is having splenomegaly or hepatomegaly, you can diagnose by palpating. Then next is percussion. Percussion here nothing but tapping. In elderly persons, in old age people, you will do percussion in knee region to find out the fluid collection, bone marrow collection, or anything like that. Or in children you have to do percussion for the lungs, especially to diagnose the pneumonia in a lungs. And next is auscultation. Auscultation means nothing but examining the child with the stethoscope. Auscultation sites, as we saw in the examination of a newborn, chest auscultation and everything you have to do with the stethoscope, so that you can find any murmurs or any fluid collections or any discomforts or complaints in a chest region. You can see with the auscultation of a examination of a child. These 5 steps comes under the systemic examination of a child. This was about the point Samanya Chikitsa Siddhanta. In first part I explained the types of diseases, causes for the diseases, and way of the treatment. And this video I explained how to treat the children, the way of treatment, and how to examine for the correct diagnosis, and way of treatment, way of the examination for the correct treating a child. So hope I think you are getting the explanation about the points. And as our university gave the notifications for the examination, the exams are coming near. If you all want any particular topic, then you can comment in the comment section box, so that I will explain the points which you needed. Okay, thank you.